Okay, let's just jump right into this explainer, where we're going to entirely demystify the hospital experience by exploring the distinct worlds of medical and surgical care. If you've ever walked through the bustling corridors of a modern hospital, you've definitely noticed the different departments, the different teams, and honestly, the completely different paces of work. So today, we're going to break down exactly what separates the medical wards from the surgical wards and why grasping this distinction is absolutely crucial to understanding how modern healthcare actually functions.
I want you to picture your own health for just a second. If you had a complex chronic illness, like diabetes or heart disease, that was suddenly flaring up, who would you see? And on the flip side, if you were suddenly struck with intense abdominal pain and needed your appendix removed immediately, where would you go? Now, while both scenarios obviously require a hospital, the type of care, the daily routines of the nurses, and the overall treatment philosophies in those two wards are literally worlds apart.
So, here is our roadmap for today. 1. Inside the medical ward. 2. Inside the surgical ward. 3. Comparing the two wards. 4. Approaches to patient care. And finally, 5. The med-surg hybrid. All right, let's kick things off with part 1, inside the medical ward. Now, you might have heard the term hospitalist thrown around, but it's actually a relatively new concept, first coined in a medical journal back in 1996. The emergence of hospital medicine essentially created this group of highly specialized doctors organized entirely around the location of care, the hospital itself, rather than focusing on just one specific organ like a cardiologist or a specific disease like an oncologist. These internists are basically the ultimate problem solvers of the medical ward, acting as the primary managers for patients admitted with internal illnesses. So, what does treatment actually look like here? Well, medical care encompasses the diagnosis and management of diseases primarily through non-invasive methods. You won't find any scalpels or operating tables on a medical ward. Instead, treatment relies heavily on long-term pharmacological interventions. That means managing some really complex medication schedules. It also includes rehabilitative therapies, preventative care like vaccinations, and intensive lifestyle counseling to manage chronic conditions. Think asthma, COPD, and hypertension over the long haul. Listen to this quote from nurses on the front lines. Medical tends to get more longer stay, complex patients with a long list of chronic illnesses. That really highlights the demanding reality on the ground, doesn't it? From a nursing perspective, medical wards often handle older patients who might be experiencing cognitive decline, delirium, or just severe exacerbations of long-standing chronic issues. I mean, medical nurses might be tasked with managing upwards of 15 different medications for a single patient. Plus, they're heavily assisting with daily living activities and coordinating discharge plans for folks who might need long-term care facilities. The pace here is deeply rooted in continuous holistic management. Okay, total gear shift. Part 2, inside the surgical ward. Surgical care is fundamentally about physical and often highly invasive interventions. Whether it's a sudden emergency procedure like an appendectomy or a planned elective surgery like getting a knee joint replaced, the philosophy here is incredibly targeted. The goal is to physically go in, alter, repair, or completely remove tissues and resolve that medical issue outright as quickly as humanly possible. Because these treatments are invasive, the entire style of patient care shifts dramatically. Unlike the chronic, long-term focus of the medical ward we just talked about, surgical nurses are locked into very defined recovery timelines. They're prepping patients for the OR and then vigilantly managing post-operative observations. We're talking administering IV antibiotics, managing acute pain, and meticulously monitoring drainage tubes for any signs of immediate complications, like bleeding or infection. Now, this quote, observations normal, afebrile, plan continue, highlights a pretty well-known and slightly humorous stereotype noted in the Royal College of Surgeons Bulletin. It's the vanishing surgeon.
Because surgeons are, constantly tied up in the actual operating theater, their rounds on the ward can be incredibly brief. They often boil down to these rapid fire status checks before they sprint right back to the OR. And actually, that can sometimes lead to a situation where the medical decision making and the hands on nursing care become a bit decoupled.
Moving on to part 3, comparing the two wards.
So, if we put them head to head, the fundamental dichotomy of hospital care comes down to this. Medical care is a long-term strategy. It's non-invasive, it requires continuous, really subtle adjustments to medications, and it focuses on managing conditions that honestly might never fully disappear. Surgical care, on the other hand, is a physical, invasive intervention that aims for a rapid, definitive resolution, which is then followed by a very specific, structured postoperative timeline.
Let's dive a little deeper in part 4, approaches to patient care. Let's look at the day-to-day duality on the hospital floor. When it comes to the care load, a medical nurse is often managing a really heavy physical and cognitive load, assisting confused or highly dependent patients with just basic daily living, all alongside these massive medication rounds. Meanwhile, a surgical nurse is operating on a strict schedule of high-frequency acute clinical observations. They are checking blood pressure, assessing pain levels, and measuring drain outputs at very specific intervals to make sure the patient is safely coming out of anesthesia. But here's something wild. It's not just the treatments themselves. The actual architectural space of the ward plays a massive role in patient care. Historically, hospitals use these things called nightingale wards. Picture long, open rooms with beds just lining the walls. Now, this gave nurses incredible visibility of all their patients at once, but it totally sacrificed patient privacy and actually increased cross-infection risks. Today, modern space programming leans towards separate patient rooms. While this is great for privacy and lowering infection rates, it means nurses have to walk significantly further distances, we're talking miles per shift, and work so much harder to maintain visual surveillance on recovering patients. Because modern wards with those private rooms make communication quite a bit more challenging, and because, as we mentioned, surgical doctors are often busy in the OR, clinical guidelines are really pushing to improve how care is delivered. The Royal College of Physicians and the Royal College of Nursing heavily advocate for structured, multidisciplinary ward rounds. By actively bringing the doctors, the nurses, allied health professionals, and the patients all together, they can prevent care from becoming disjointed and ensure everybody is on the exact same page regarding treatments and discharge plans. But wait, let's think about the reality here. Human health is rarely black and white. So what happens when an elderly patient with severe diabetes and heart failure falls and shatters their hip? Well, they obviously need surgery, but they also require intense ongoing medical management. This overlap leads us to our final synthesis. And that brings us to part 5, the med-surg hybrid. Because of this complex overlap, a med-surg nurse must possess an immense, highly adaptable knowledge base. They aren't just doing one or the other. They are handling both chronic medical exacerbations and acute surgical recoveries simultaneously. They have to be able to expertly manage a patient's complex internal medicine needs, like carefully monitoring insulin or blood pressure medications, while at the exact same time managing their postoperative surgical drains, wound care, and pain relief. It's a huge balancing act. And because these hybrid wards handle such an incredibly diverse and complex mix of patients, communication is literally a matter of life and death. Structured communication tools like the ISBAR-Q handoff method are absolutely essential here. These tools ensure that when nurses change shifts, every single critical detail, from a patient's internal lab results right down to their surgical wound status, is safely and comprehensively transferred. That way, absolutely no vital information falls to the cracks. So, I'll leave you with this provocative thought to ponder. As our population ages and medical conditions just become more and more complex, the lines between purely medical and purely surgical are going to continue to blur. It truly underscores how modern healthcare relies on the seamless collaborative integration of both of these disciplines to help patients truly heal. Thanks so much for joining me for this explainer, and remember to keep questioning the systems that keep us healthy.